So the doctor came in halfway and said that I'm really allergic to. Good morning. I'm Kelly. This is my channel, Incredible Anyway, where I talk about how to live an incredible life, no matter what your circumstances are. I've been off all allergy medications for 5 days, and my Pepcid. That has been so hard for me. Today I get testing for allergy and asthma. Benny is coming with me. I washed his coat. I washed my coat, so any like fur dander that's on there is, you know, off right this minute. I washed his shoes. I stripped his fur. It took 2 hours. I am a little nervous they're gonna give me a hard time for bringing in a service dog into an allergy and asthma place, but the Americans with Disabilities Act says that you have to accommodate both people. So if there are people that have, allergies to dogs, you have to accommodate them as well as the person with the service dog. So I'm gonna notify them when I get there if they haven't already seen him and say, if you'd like to, you can put us in a separate room to keep us away from other people. They said that the appointment can take 2 to 3 hours. I did have allergy testing back in 2004, and I briefly got allergy shots, but because I was chronically ill, it was very hard for me to make a drive in there. I wasn't consistent enough, and because of the nature of allergy shots, they can't just let me do them at home. I was diagnosed back then with asthma and allergies. As I've lived in Kentucky, they have really bad allergens here, and every spring when the trees bloom, my asthma gets really bad, and it got so severe this year that that's actually why I wasn't able to go to do the original date of my brain surgery. So I had that asthma attack, which was really crazy. It's never been this bad. It was so painful. I didn't at one point when I was looking for my inhaler, I started to get a little scared. I was taking puffs of the inhaler and it wasn't getting better. I took more puffs than I should have. Then it's prescribed because I was that scared. I was like, please calm down. And feeling an immense amount of tightness. Getting up and walking around hurts to breathe. Asthma reaction to the trees blooming. If my asthma doesn't improve in the next 2 weeks, it could affect my ability to have surgery. It hurts in my chest to talk. I'm disappointed that the nebulizer's not opening me up more. A lot of times people are prescribed steroids, and I can't do steroid right before surgery. So it's really hurting to breathe. It's midnight now. The doctor called me 15 till 10 p.m. I didn't realize it, but my pharmacy no longer is 24 hours. They closed at 10. They just would not fill it. I feel like somebody's got a grip on my trachea right now. I feel like going to the ER is such a horrible ordeal. My whole chest aches. My mom has picked up my, so I just got these. I did the Duonub a little bit ago. I've never done steroid inhaler, but I'm pretty sure it's the same. I'm still wearing the clothes I was wearing yesterday because last night was so bad I didn't know if I was going to go to the ER, and frankly thinking about changing my clothes felt too much. Telemarketers or whoever calls, you always lie and say you're okay. It hurts to breathe. It hurts to be on this phone call with you. I only picked it up because I thought it was from my hospital. So when he asked me, how are you doing? I said, I'm not good. And I could tell he was not, he was not expecting that. I feel so terrible, and it felt so good to say it. It's hurting so much to talk, but it's time for my nebulizers. I really hope it helps because it's hurting a lot. The first line is, the future's gonna be okay. I look in the mirror and I see no pain. I'm overwhelmed. Hurts to cough. I don't even want to cough. We've been hoping that I could get allergy shots November of 2022. I went into a doctor to get evaluated for allergy shots, but unfortunately the medication, cardiac medication I was on, was contraindicated with, like, if I needed to have like a EpiPen, an EpiPen wouldn't work as well. And so they wouldn't do allergy testing. Over the course of this year, in addition to my brain surgery, it took a little bit extra time, but I was able to switch cardiac meds, which actually the cardiac meds I'm on now are better. And I get them because my blood pressure gets really low, my heart rate gets really fast, and the combination makes me pass out. At least I'll be under the care of somebody who can help me out specifically with this if and when it does get bad in the spring again. Every year I've lived here, it's gotten progressively worse. It was bad when I was living in Chicago. I have vlogs, which you can't see these vlogs because I was married then, and I just choose to not have those vlogs public anymore. But I'll show you guys a clip. I have a vlog of me wearing a mask outside, and this was back in 2018 during the spring because allergens would affect me so much.
Day 15. Woo woo. I still have a migraine. Here we go. It's just fun. Look at all the park rules. No cars, so don't drive in the lake, guys. All these trees are getting green. I think even our corner tree up there looks like it might be having some leaves.
Because I'm nervous about how my body is going to react, because I react pretty strongly to things. I'm nervous that it's going to be so itchy. I can't take Benadryl because I've had really bad reactions to it. My ears are itching, like, ugh. Doing that all the time now. They tell you to wear an old t-shirt, so I'm wearing an old t-shirt. It actually has a hole in it. I got this t-shirt when I was, I'm gonna say 12 or 15. So long ago. I always had my dogs as my lock screen, but recently I just kind of needed like a happy smiley. Cute screen. His smile always feels like a warm hug. That's my boyfriend. His name's June. I call him June, sometimes Junie. No. Oh, I feel like I'm gonna sneeze again. So I told my mom we were gonna leave at 5 minutes before we needed to leave, and she's still late. It's 5 minutes after the time we need to leave. I just called her and it went to voicemail. So, and then I called her again and then it got to her, but she and my dad are recovering. Like, they just got home. And
there's Kelly. Hi Kelly, how you doing?
You left half of you in Asia.
Oh, you did, eh?
Look at how good you look.
There's nothing there.
Guess what?
What?
The biopsy's been approved.
Yay.
I just heard. Yay.
How exciting.
And I'm getting it Thursday.
the jet lag has to be terrible. I told her I would get somebody else to drive me, but I'm really, 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 really thankful. I think what I've learned with anxiety, this is not anxiety, but what I learned with anxiety is just do the next thing. And that way you don't think about the whole picture and the worries or the anxiety or the nerves that can come with that. So the next thing is just getting there, getting through the door. We're here. So they put us in a room. It's big. I knew right what to do. As the moment I told her that I had a service dog, she went and asked somebody while she signed me in if they could give me a room. So that was really, really cool. So she just put the pin pricks. I can already feel different places. I think it was 80. I was counting, and when we got to 40, she said, we're halfway done. So we sit here for 15 minutes. It itches so bad. It's so bad. I'm definitely allergic to something. So the doctor came in halfway and said that I'm really allergic to dogs. We're not done. It's itching so badly. I'm more reactive to dogs than to cats, which is not what I thought at all. I thought I was way more allergic to cats. Out of the 80 spots, this many were negative, so a lot were not negative. But there were negative ones, so they retest on the arms. They inject a little serum into the arm, that's why there's a bump, to make sure that it's negative. And then if it's negative on the arm, then you are truly negative. I am home. Here are the reactions, the results. I'm allergic to a lot of things. So they did 80 tests, and I think I was allergic on my back to 75% of them. The other 25% they did on my arm. Some of those little injections weren't pleasant. The ones on my arm, I was allergic to a good amount of those as well. The 3 top things I was allergic to, or top 4 things, was the top one was dust mites and ragweed were both very reactive, and then dog and horse, which I'm never around horses. And I mean, in Kentucky people work with horses, and he said, you know, you could go places and just be cross-contaminated. Most of the trees, all of the grasses, most of the mold, if not all, most of the like weed pollens. It was a lot. I'm gonna stay on my allergy medications. My asthma, I told him my asthma doesn't get bad until spring, which is great, which means that now my lung stuff didn't look very bad, so that was good. So they did some testing. I think I'm just like wearing down. I still feel like a little floaty boaty on when I walk on uneven grass. I don't feel as grounded. So I'm gonna be getting allergy shots. We're gonna try something called a cluster. He's like, basically you'd have to take prednisone among like 3 other medications with it. I really have these strong reactions to prednisone, and he said, well, maybe it's a dose dependent thing. I don't think so, but I'm willing to try anything once. The reason we're doing it with these medications is because we're going to be doing what's called clusters, so we're going to be trying to do a higher dose of the allergy. Tested me. I don't know if that's like I feel like vomiting. I'm gonna go in. What is wrong with me? I can't tell if it's a vestibular reaction. It could be. It could be. I'm feeling nauseous. I think it's just a vestibular reaction that I'm having. Did you hear that? Esophagus problem, which is getting fixed on Monday. How's my Dashi? My Dashi poo. Hi, baby. The stuff for the allergy shots will take a week to 2 weeks because they have to mix up the vials. They taught me how to use an EpiPen. I'm not doing okay. I think I used everything I had. The reason that my ears are so itchy, he said that the skin in the inner ear is more sensitive than like your eyelid skin. And so it'll be the first thing sometimes to react to allergens. They told me that when somebody has allergy to dogs like I do, to keep them out of the bedroom. And she was like, I know we can't do that with you, with your service dog. And like, we can't do that with me because I live in my bedroom right now anyway. Looks better. Apparently that comes off with soap and water. I feel like I've been hit by a truck, and I have a feeling that it's because my immune system is like, why did you make us react to all of those allergens? To motivate myself to get from here to the bedroom, I'll put on music. So I'm gonna play this song called Good Day. I'm not gonna be able to play it on YouTube, but it's by Strive to Be and Leahona Olayan. I've been listening to it for a long time. This is the Spotify. I can sit and cry about reasons why I'm in this mess, but what good is that? What a waste of breath. It's a fine line thinking about the words unsaid and setting me free from my chest. I feel so low. I'm not myself. I feel so low. I'm not myself. Not Betty. Things might not be going my way, but it's gonna be a good day. I'm gonna switch from you're recording on my iPad. We're going to record. My brain and my body are just, I feel like I'm living in this, if you have this, you understand, but like inflammation-induced haze. So I'm gonna stop. I'm talking to try to cope. I am Kelly. You are not alone. Live incredible anyway. That, like, ask any of my loved ones that have been around me when I don't feel well. I just keep talking. I just keep talking because it's distracting. I will keep talking and talking and talking and talking. Hey, it helps to know what helps to cope. And if it's talking, so be it.
You are not alone in this world. You are not alone. You are not alone in this world. You are not